Hi, everybody. Caregivers today are saying to me, why do I feel threatened? Do my parents really need 24-hour care? What happens if I disagree with the doctor or an assisted living community or a nursing home? Stay with me for the caregiving chat of the day. I'm Pamela D. Wilson. My website is pameladwilson.com. And in this video post, there is a link to an article that I wrote about patient engagement and education, which is the subject of this email and part of the solution to the question, why do I feel threatened? Caregivers interact with a lot of different medical systems. So depending on the health of your spouse or an elderly parent, you may be dealing with hospitals, nursing homes, assisted living communities, in-home healthcare providers, daycare providers, a number of different situations. In all of these situations, the more educated you are, the more confident you are. So is it okay to disagree with a doctor? Is it okay to ask, why do my parents really need 24-hour care? And why can't I take them home? I've been in many caregiving situations over the years, and hospitals usually are the first point of disagreement, and that could be about discharge planning to a nursing home. It could be about guidelines around going home. They may tell you, as may nursing homes and other communities, that your parent needs 24-hour care. What does that really mean? In their eyes, it means that your parent is not safe to live alone and that someone should be with them 24/7. But what they don't tell you is it a short-term situation? Is it a long-term situation? They don't give you a lot of information about it. Part of the reason is, if you think about it, it's liability. If your parent needs a lot of care and they don't say your parent needs 24-hour care and something happens, people could go back to the hospital and say, well, you didn't tell me my parent needed 24-hour care, and look at this horrible thing that happened. As the caregiver, it's up to you to say, okay, maybe mom or dad need 24-hour care for 2 days, maybe it's 2 weeks, maybe it's a month just to see how they do, and then maybe we have to look at other options. The same thing goes for nursing homes. A lot of nursing homes, when they discharge parents or spouses, will say, oh, they need 24-hour care. But again, not a lot of details, not enough details. And many times caregivers don't know how to navigate that. Do I give up a job to take care of an elderly parent? Do I hire an in-home care company? All of these discussions about all of this care are in my program called Taking Care of Elderly Parents at Home, that is available through corporations and groups. You can find information about it on my website. You can talk to your company about it, to your group about it, because working caregivers struggle to find time to take care of elderly parents, especially if the recommendation is 24/7 care. Then there are other situations where a parent might be in a nursing home and need what's called medical care. And you want to take them home as the caregiver, but you're afraid of, can I use a feeding tube? Can somebody train me on how to use a feeding tube if my parent has a feeding tube? Or other types of medical issues, managing insulin, diabetes-related conditions, skin wounds. All of that medical care is now being transferred from the hospital and the nursing home to the private home that really is becoming much like a hospital. Caregivers are afraid of these things, and sometimes they do feel threatened by care communities when they're saying, well, you shouldn't take your parent home. I'm not sure you can do this. Or they're being discharged. You have to learn how to do all of this. It's easy for caregivers to feel threatened by care situations when you don't have the education or the support to know how to manage it appropriately. Help for Caregivers, Aging Adults is on my website at pameladwilson.com. Join me Wednesday night. We are going to be talking exactly about this subject on my radio show. The topic of the radio show is what is against medical advice, and also information about physician burnout and how that can negatively affect your care, the care of aging parents, or a spouse. I'm Pamela D. Wilson. My website is PamelaDWilson.com. Please share this information with other caregivers, aging adults, everyone you know, and your groups and corporations. Encourage them to contact me about my caregiving course, my caregiving programs, speaking events for caregivers in the workplace, and caregivers everywhere. Have a fabulous day today. I'll see you in another video. And Don Wessenen, hello there. Good morning. I hope you are doing well in Wisconsin today. Have a great day.